So let's talk about some strategies to grow. And we want to grow at least 10% a year. You're welcome to sub whatever percentage you're comfortable with. And maybe it's larger than that. But here's some specific things you can do. I'll number these and kind of talk about each one in some detail, then I'll go to the next one. Number one, I want you to get really good at adding same-day dentistry. Same-day dentistry. Now, Naren, the term same-day dentistry has two different meanings in the dental profession. One meaning has to do with using CEREC or CAD/CAM dentistry, meaning that you're going to prepare the tooth for a crown and you're going to provide the crown in the same day because of the in-office technology that you have with CEREC. Now, that is an accurate definition of same-day dentistry, but that's not the context that I'm using it here. The context I'm using here is that we're going to add dentistry to our schedule the same day. We're going to add treatment to our schedule that isn't already in our schedule when we start in the morning huddle. We're going to start in the morning huddle. We look for opportunities to make the most of the day. Now, I've done some serious study around this. World-class practices, which I'd like to think, Doctor, you either have one or are aspiring to be one as a listener of the Thriving Dentist Show. World-class practices end up with more production at the end of the day than they started in the morning huddle 80% of the time. Think how magical that is, Naren.
Yes.
They don't hit it 100% of the time, but 4 out of 5 days, in other words, they looked at what their production was in the morning huddle, and then at the end of the day, they ended up north of that number. They ended up with more than that. More average practices or less than average practices go backwards. Why do they go backwards, Naren? So why would they go backwards if they have X scheduled at morning huddle, but at the end of the day, that number is actually lower than they started with? What would be the main reason why that happens?
I think the reason it happens, Gary, is because of no-shows and cancellations, right? People,
cancellation, no-shows.
Yeah.
You hit it right in the head. And then, that's a reality in every practice. I wish I could wave my magic wand and eliminate those from any of us having to experience those. I can show you some ways to radically reduce them. But cancellation no-shows are a reality. And yet those world-class practices have cancellation no-shows as well.
Yeah.
Maybe they've reduced them, but they have them, but they still end up with more. And one of the ways they do that is they're totally dialed in to adding in same-day dentistry. They look at the morning huddle, they look at the schedule, and they look at who do I see in hygiene today that has unscheduled treatment plans. In other words, treatment that's been recommended that remains to be completed. And they look at those very intentionally. Maybe Naren has some fillings on the upper left that are asymptomatic. They don't hurt, and yet it remains to be completed. The hygienist can say to you, if we plan this out in the morning huddle, the hygienist can say to you, Naren, I see that doctors recommended some fillings on the upper left. These fillings don't get better on their own. Left to their own devices, the decay only gets worse. Right now, we know we could replace those fillings, with new fillings. But if we wait till it hurts, it might be something a lot more complicated, like a root canal and crown. Now, Naren, I don't know if this will work for you, but if you're scheduled for a hygiene appointment, but at the end of your hygiene appointment, we could move you over here to this room and doctor could do those fillings for you today, save you a trip. And now remember what time of the year that this episode is being published. We might also be able to say, Naren, our insurance coordinator took a look at it. It looks like you have some benefits left this year. And remember how your insurance works. If you don't use those benefits, you lose them. When the clock strikes midnight, when the ball in Times Square drops at midnight on December 31st, if you haven't used those benefits, they don't roll over for you for the next year. You lose them. They go back to the fat cats at the insurance company. So not only could we save you a trip, but we could help you utilize those benefits that you have. No, that's not going to work 100% of the time, but world-class practices, this is part of the everyday thinking. We look at opportunity to add emergencies, and we look for a morning emergency time and afternoon emergency time. And maybe there's an opportunity to do more than palliative treatment if we have an emergency patient. We look at services that can be auxiliary driven. For example, whitening would be a good case of that. Hey, because that doesn't impact the doctor's time. If we have the room for it and many offices do, then we look for opportunity to add auxiliary driven treatment so that, again, we can grow the practice based on the patients that we're seeing today in our practice. All right, tip number 2. So tip number 1 is embrace adding same-day dentistry. Tip number 2 is get your hygiene occupancy to 92% or above. Now, hygiene occupancy is a term that we use with our clients. What it means is, of the available hygiene appointments you have in your practice this month, what percent of those got filled with a butt in the seat? I borrowed the term from the hotel industry. We hear about hotel occupancy, Naren.
Yes.
And if a hotel says, hey, we had 92% occupancy last night, that meant that of the available rooms, of all the rooms they had available, 92% of them got filled. So our goal is to have hygiene occupancy at 92% or above. 92% or above. By the way, that's a very difficult goal. Now, how does that serve our growth plan? Because if we keep hygiene filled, it gives us growth from the hygiene production. Plus, it allows us to do more doctor exams that represent, potential treatment that could be put on our schedule. In some cases, could even be put on the schedule same day. So getting hygiene occupancy to 92% or above. And we do that primarily through a dual confirmation system. We have a default confirmation system for our everyday, loyal patients. And that reminder system is they get appointment reminders 7 days, 3 days, 2 days in advance, 732. They can respond back to any of those, or we send them primarily by text. They can respond back and opt out of future messages. If they opt out of future messages, then they get one more reminder the day before. But we have a second hygiene appointment reminder protocol for our at-risk patients. And I'm using the term at-risk, meaning at risk of not showing up. Normally at-risk is used as a medical term. But in this case, I'm using it as a behavioral term. They're at the risk of not showing up. They get a different sequence. They get the first reminder 14 days in advance. The second one, 7 days. Then it goes 7, 6, 5, 4, 3, 2. Yes, we are stalking them at this point. They can respond back and opt out of future messages. And if they do, they get a reminder the day before. But most of these people, almost all of them, don't respond to anything. That's why they don't show up. They don't respond to any of this. They made the appointment 6 months ago and then don't respond. So we send them, we are stalking them at this point. We send them one last message 2 days in advance. And if it was you, Naren, the message would say, Naren, this is Susan reaching out to you from your dental office. We have you scheduled in 2 days for a hygiene appointment. However, I haven't heard back from you to confirm that appointment. If you'd like that appointment, I need to hear back by 2:00 today. If I don't hear back from you by 2:00, you'll no longer have that appointment. It's yours if you want it. You just have to let me know you're coming. And then if they don't respond, we take it away and we fill it. Now, the hygiene schedule coordinator has 2 days to fill that appointment. Has 2 days. It's very likely that she can fill it. That's one of the ways that you get to 92% or above in hygiene occupancy. Number 3, this is both a behavioral and a tactical tip. We've got to get your team to embrace growth. We've got to get your team to embrace the idea of growing, that a growing practice is a thriving practice. And we want everyone to be involved at every department. Your hygienists need to know what they can do to support that. Your assistants need to know what they can do to support that. Your admin team needs to know what they can do to support that. And we want to really frame that around that noble cause. We want to help more people in our community enjoy the benefits of great oral health. When everybody's on board, it's amazing the results that you can get when everybody, not just you, Doc, but when everybody is embracing the concept of growth. Now, I'm going to get very tactical with you with a 4th tip. And the 4th tip that I'm going to suggest in terms of your monthly growth plan is to have a designated doctor scheduling coordinator. A designated doctor scheduling coordinator. Someone that is accountable and responsible for filling your schedule. The act of having a dedicated doctor scheduling coordinator where that individual knows what our monthly goal is, what we're going to do, and she's scheduling toward that will go a long way towards making it. It's now no longer a wish, but now it's being tactically figured out day to day. So there's those 4 tips. Embrace the concept of adding same-day dentistry, tip 1. Number 2, get your hygiene occupancy to 92% or above. Tip 3, get your entire team supportive of growth. And tip 4, having a dedicated doctor scheduling coordinator. And now I want you to put that in the context of, what are you all going to do this month to make that happen? Look very granular at the details of this month and break that down to day. What do we do every day to make that happen?